would say working with the people that I work with, I think they're great. We actually get along really well. We hang out outside of work, so I think, if you're going to be spending that much time with people, you really should get along. So we generally do really like each other, and I think that comes across to patients. They usually recognize the fact that we do get along so well. We're always joking around while we are professional at the same time. Also, I do like taking care of patients. It's great because they come in and usually they have a series of procedures, so you're going to see them for a while, so you kind of get to know a lot about them, so that's the part I like too. Before a procedure, they're concerned about what they're going to feel. So this is not something that's really common where they know exactly what's going to happen. So when they first come in, my job is to let them know what they're going to feel. It's hard to say, you're not going to feel any pain, but I try to make it realistic. You're going to feel pinches and pressure, and just keep that in mind. And if they are uncomfortable, they just have to let us know, and we can always kind of change what we're doing to make it more comfortable for them. So there really isn't a type of person because venous disease affects everyone. However, we mainly get women, in their mid-40s, 50s, or after they've just had children. That's the typical client we see. However, we see a whole variety of people. We get the construction worker who dropped a 2x2 on his leg and now has phlebitis. And that's why they come in. So, we treat pretty much most age range as long as they're healthy. So we see a variety of patients. I usually say, hold on to the stockings, compression stockings, because even though everyone hates them, they're a great investment. So they do help anytime you're flying or long car rides, or if they're going to be standing for a long period of time, just to wear them whenever they can, because that will help, slow down the progression of venous disease. Also, I always recommend just doing follow-ups because it is a chronic and progressive disease. So we always do these procedures and we never want to just let them go. We always want to follow up with them so we can kind of take care of something before it leads to a varicose vein or spider vein. So when they first come in, we want to know exactly what's going on. So we take a look at their legs. We also take a look at their venous history and what type of symptoms they're experiencing. From there, we usually will order an ultrasound. That ultrasound will help us determine whether they do have that backflow or venous insufficiency. And from there, we come up with a treatment plan. They meet with Dr. Afshar for a series of visits. And then they have their procedures, and we try to do them back to back so that they're more convenient for patients. They're in and out of stockings a lot quicker, and you get better results that way. Again, it always comes back to compression stockings. Everyone hates them, but they're great in preventing, ulcers, varicose veins in the earlier stages. It will never take care of the underlying issue, but they do help. Also, elevating your legs, being active definitely helps, especially walking. It's a lower impact exercise that most people can do. And I would just say getting a venous screening so that they know ahead of time they could take care of it before it turns into something. I would definitely say it's our staff because we all really care about the patients. I've had multiple compliments, especially in the past few weeks actually, where they say, my daughter went somewhere, down south, and she had the total opposite experience of what I've had. She said that, they just didn't care. It was just a job to them. And she said, my experience is totally different from this office. And many people say this is like a different office than they've ever been to before. So I would say that our staff and how well we get along kind of shows it comes across to the patients. So that's why they remember us and refer us to other people.